Hello everyone and welcome to our module on other drugs of abuse. We'll start with PCP, which is phencyclidine. This is its chemical structure shown on the screen here. It's also commonly called angel dust. This has two effects that lead to the reasons why people abuse this drug. First of all, it's an antagonist of NMDA receptors in the CNS. NMDA stands for N-methyl D-aspartate. These are the glutamate receptors in the central nervous system. And when you block those, that leads to hallucinations and psychosis. In addition, PCP inhibits the reuptake of dopamine, norepinephrine, and serotonin, which is also called 5-HT or 5-hydroxytryptamine. And when you block the reuptake of these neurotransmitters, you raise their levels in the central nervous system. And one of the effects of this is that it's going to increase sympathetic nervous system activity. So if you know what I've shown on this slide here, it's very easy to understand what a PCP intoxicated individual looks like. They will be hallucinating and they will have increased sympathetic nervous system activity. So the clinical features of PCP intoxication are shown on this slide. The drug is a stimulant. It also alters the mental status. Patients who are PCP intoxicated can have features of psychosis with hallucinations. They also have what's known as psychomotor agitation, which basically means that they are agitated. They're classically agitated and violent. They often get into trouble with the police because they are high on PCP. Because of the sympathetic nervous system stimulation, they can be tachycardic and hypertensive. When you examine them, you will often see nystagmus. These are repetitive involuntary eye movements. And then rarely these patients can go on to enter a coma or to develop seizures. People who die from PCP usually die from trauma. First of all, they are psychotic, so for this reason they can do something like crash their car. In addition, they typically don't have much pain sensation, so this can cause them to do stupid things like punching through windows or jumping off of buildings. In addition, sometimes the psychosis causes them to dissociate. This means they feel like they're outside of their body, so for this reason they might walk into traffic, or like I said before, they could jump from a building. These are all dumb things that people do, but it's because they're psychotic and they're not feeling any pain. The treatment for PCP intoxication is benzodiazepines, which are central nervous system depressants, and also haloperidol, which is a rapid-acting antipsychotic. Next, let's talk about LSD, which is lysergic acid diethylamide. If you've ever heard of someone dropping acid, they are talking about taking LSD, which is sometimes called acid for short. This is the classic example of a drug that is a hallucinogen. It causes people to hallucinate. The exact mechanism by which it works is unknown, but it may have to do with binding to a special subtype of serotonin receptors called the 5-HT2A receptor. Importantly, this is not a stimulant, so contrast that with PCP. So both patients on LSD and patients on PCP may hallucinate, but only patients on PCP will be stimulated and be hyperactive and be violent. Patients who take LSD tend to hallucinate and to be more mellow. So people who take LSD describe the hallucinations as a trip. They have a feeling of expanded consciousness, like they can sense things beyond the usual reality. One of the things they often report is what's known as synesthesia. This is a blending of the senses, so they feel like they can hear colors or see sounds. Patients on LSD also often say they feel depersonalized. This means they feel like they are disconnected or detached from their body. And in some cases, people have what's described as a bad trip. This is where they hallucinate in a way that makes them feel poorly, like they become paranoid or anxious. People who are LSD users are famous for having what's known as flashbacks. This is a return of the LSD effects after stopping the drug. It can occur days, weeks, or even months later. So someone who has cleaned up but used to use LSD may suddenly have a flashback where they start to hallucinate, and it's the effect of the drug that they took several weeks or several months ago. And if someone comes into the ER intoxicated on LSD, the treatment is just supportive. There's no antidote. Usually you don't die from this drug, but you just feel very whacked out for several hours, and you support the patient till the drug washes out of their system. Next, we'll talk about ecstasy, which is also called methylene dioxymethamphetamine, or MDMA. This is a variant of an amphetamine, so it's a stimulant, and it is structurally similar to serotonin. This is its structure on the bottom right side of the screen here. It shares some features with serotonin, and its major effects are on serotonin activity in the brain. It can increase the release of serotonin and inhibit serotonin reuptake, so patients experience the effects of this drug largely through more serotonin activity in the brain. People who take this drug experience a sense of euphoria. They also tend to feel alert. And then a classic feature of someone who has taken ecstasy is bruxism. That means grinding of the teeth. For reasons that aren't well understood, this is something that people who take ecstasy commonly do. There are a couple of dangerous effects of ecstasy. First of all, because it's a stimulant, it can cause tachycardia and hypertension. It can also raise the body temperature and cause hyperthermia. One of its most dangerous potential effects is hyponatremia, so people who take ecstasy get very thirsty and they drink lots of water. In addition, the drug promotes the secretion of antidiuretic hormones, so these two can combine to cause very low sodium levels, and there are reports of seizures and even death from hyponatremia among patients using ecstasy, and it's high yield to know this for your boards. And then finally, this drug has been reported to cause hepatotoxicity, so a patient might come in who has taken ecstasy with right upper quadrant pain and increased liver function tests. The serotonin syndrome is a clinical syndrome that occurs when people have too much serotonin activity in the brain. I talk about this in the video on antidepressants because a number of antidepressants have been associated with the serotonin syndrome because those drugs work on serotonin levels, but you can also see the serotonin syndrome among people who take ecstasy. Classic triad of the serotonin syndrome is known as the 3 A's. The first A stands for agitation. That's because people with the serotonin syndrome have mental status changes. They have agitation, restlessness, and disorientation. The second A is autonomic hyperactivity. These patients are sweaty, they are tachycardic, and their body temperature will be raised. And as I told you before, you can also see this among people using ecstasy who don't have the serotonin syndrome. And then the final A is for neuromuscular hyperactivity. So their muscles tend to go haywire. So they can have tremor, they can have clonus, hyperreflexia. Sometimes if you examine them, you will find bilateral Babinski signs. The treatment for the serotonin syndrome is a drug called cyproheptadine. It's a serotonin antagonist, and it will block the effects of serotonin and limit the symptoms of the serotonin syndrome. Ecstasy withdrawal is what happens to people after they use this drug. There's a crash that is associated with being high on ecstasy. The next day after people use the drug, they often have depression and anxiety. They are often tired and lethargic. They can find it hard to concentrate, and they can have a loss of appetite. And in addition, they often have jaw soreness, and this is because of grinding the teeth when they were high. I'll finish this video by talking about marijuana, which most people call pot. It derives from a plant called cannabis. People usually smoke this drug, and the psychologic effects are from a component of marijuana called tetrahydrocannabinol, or THC. It's also called dronabinol. This substance can stimulate receptors in the central nervous system called cannabinoid receptors, and when they do, it leads to the effects of marijuana. These include a sense of euphoria, increased appetite. If you've ever met people who have been smoking pot, they're usually starving and gobbling down food. Ataxia, slurred speech, impaired judgment, and impaired cognition. Rarely it can cause anxiety or panic attacks, but usually patients have a sense of euphoria and are more mellow after smoking pot. There are synthetic cannabinoids that are available for medicinal purposes. These are pharmaceutical forms of THC or dronabinol. They're available in capsule form, and they can be prescribed to patients for 2 FDA-approved usages. The first one is chemotherapy-induced nausea and vomiting. This often helps patients who have severe symptoms related to chemotherapy. The second one is for appetite stimulation. Remember, I told you that people that smoke pot often get very hungry, so you can administer synthetic cannabinoids to stimulate the appetite in people who have wasting illnesses. This is classically used for patients with end-stage HIV and AIDS. They can lose their appetite and become emaciated, and you can use synthetic cannabinoids to stimulate the appetite and to help them gain weight. And that concludes our video on other drugs of abuse.